now that we are done with upper limb, let us go on with lower limb. In lower limb also, it is gonna be bones, the muscles, the nerves, the vessels, and the spaces. Okay, so for bone, the pelvis bone is very important. Regarding the pelvis bone, we'll be discussing it in obstetrics and gynecology. Just know that there is a pelvis bone which will be just like the scapula of the upper limb. Okay, then there will be the femur, which will be like the humerus of the upper limb. Then there is tibia on the lateral side, sorry, on the medial side. Then there is a fibula on the lateral side. This is the tibia, this is the fibula. This is just like the radius and ulna. Okay. Then there are the tarsal bones, just like the carpal bones. Then there are the phalanges. So before that, there are metatarsals and the tarsal bones. Okay, so these are the bony structures that are there in the lower limb. That is all and everything you need to know. There is not much of an importance that is given to bones of the lower limb other than the pathological part, which we will be discussing in orthopedics. Moving on further, so muscles of the pelvis will be divided as external pelvis muscles and the internal pelvis muscles. Internal pelvis muscles, I'll be discussing it when we go to obstetrics and gynecology. We'll be more keen towards the external pelvis muscles here in lower limb. Okay, in the lower limb discussion basically. So external pelvis muscle has two things. One is external rotators of the thigh and the internal rotators of the thigh. Okay, external rotators of the thigh are piriformis, obturator, and gemini. Okay, piriformis, obturatus, and gemini. These are the external rotators which rotates the thigh externally. Internal rotation is by the gluteus muscles, that is gluteus medius and gluteus minimus. Okay, so please remember this and don't forget, internal rotation is caused by gluteus muscles, whereas external rotation is caused by piriformis, obturatus, and gemini. Internal rotation and the abduction will be caused by gluteus muscle. This is also an important point that I need you guys to remember. Abduction of the thigh and also the internal rotation. Please do not confuse. Like external rotation is caused by these three muscles. That is why outward movement is also being caused by these three muscles. That is the abduction. The out towards the body is adduction. Outwards from the body is abduction, right? So we think external rotation is also away from the body, so we tend to write these three muscles, but no, it is not the thing. So it is gonna be the gluteus muscles itself which is gonna cause the abduction here. Okay, so that is the one thing that I need you guys to remember. Okay, that's all. That's it for pelvis muscles. Then coming to the thigh muscles, there are compartments in the thigh. Okay, in the lower limb, just think that there are compartments. Okay, there is a compartment of anterior, medial, and posterior in the thigh. That is anterior, medial, and posterior compartment. Okay, so if we take a section of the thigh like this, it is gonna be anterior compartment, the medial compartment, and the posterior compartment. Okay, this is how the thigh would look like if we take a section. In the same way, if I take a section of a leg, it is gonna be anterior, the posterior, and the lateral. Okay, so there won't be any medial. Okay, so there won't be any medial compartment in the leg. Okay, so it is gonna be anterior, the posterior, and the lateral. Okay, so consider this being the lateral and this is the medial side of the thigh we were discussing about. So lateral side, right? So laterally there is a compartment, anteriorly there is a compartment, posteriorly there is a compartment. In posterior compartment of the leg, there is superficial and deep compartment. Okay, we'll come back to that. So just remember, there are compartments with respect to thigh. Why are these compartments important? Because for there comes a pathology where there is increased pressure inside the compartments, where we have to give do a procedure named as fasciotomy, where we'll be cutting open the fascia of these compartment. If the anterior compartment is having high pressure, then will be doing the anterior compartment fasciotomy. Okay, so in that way, that these compartments are important. So moving down, so in the anterior compartment of the thigh, as I was discussing, right? So anteriorly there is a compartment. Here the quadriceps muscles are there, the sartorius muscle is there. Okay, so that's all that is important. So one is quadricep muscle and the sartorius muscle. Sartorius muscle is the longest muscle in our body, you know that, right? So sartorius will be in the anterior compartment, then the quadricep muscles. Then coming to the medial compartment of the thigh, it is gonna be adductors. See, adduction, medial moving towards the body, adduction, right? So adductor muscles are there. Okay, then coming to posterior compartment, it is gonna be the gluteus. Okay, so from the pelvis, it is gonna be moving down in that way only. So in the posterior compartment, it is gonna be gluteus muscles. Okay, remember in that way. And just coming just below the gluteus muscle, there is one important muscle group, that is hamstring muscles. Okay, so please remember, the hamstring muscles are also in the posterior compartment. Anterior compartment is the quadriceps and sartorius, adductor compartment because adduction is towards the body, then posterior compartment, above will be gluteus muscles, below will be the hamstring muscles. Okay, so that is all and everything that you require. So in the compartments, so the important nerves that will be supplying these compartments are, in the anterior compartment it is going to be the femoral nerve, in the medial compartment it is going to be the obturator nerve, then in the posterior compartment the sciatic nerve, which is the thickest nerve in the body, thickest nerve in the body. The main thing, sciatica, you would have heard in your clinicals, right? Sciatica, many people would come with back pain and they'll be telling the radiation till lower foot also the radiation is there. This is the nerve that will be affected in disc prolapse and all these things. In disc prolapse, many other roots of the lumbar plexus will be affected, but rather than that, let us focus on the sciatic nerve now. Okay, so many other lumbar plexus will also be involved, but most probably it is going to be the sciatic nerve which will be involved, because sciatic nerve will be having its roots from all of the lumbar and sacral roots. Okay, so that is why it is important. So this is the nerve supply of the thigh. Okay, then coming down, one more important point I want to tell you is, obturator nerve is a hybrid nerve. Okay, so remember this point, hybrid nerve. Okay, so that is one point that I want you guys to remember. Then moving down with respect to compartment of legs, in the same way as I discussed about the compartments of thigh, it is gonna be, I told you, right, anterior compartment, posterior compartment and the lateral compartment. Posterior compartment has two things, one is deep and the other one is peripheral. Okay, deep compartment and the peripheral compartment, superficial compartment. Okay, so the muscles of the anterior compartment, posterior compartment are not much important. Only two muscles that I want you guys to remember is, in the posterior compartment there is gonna be something known as gastrocnemius. Gastrocnemius, you know this, right? The Achilles tendon. Achilles tendon. Why Achilles? You would have gone through the movie called Odyssey or Troy, right, where Achilles will be there and the arrow will be shot towards the Achilles tendon. Okay, so that is why the name Achilles tendon. So this is the muscle that gives the Achilles tendon. Okay, so gastrocnemius is what forms the Achilles tendon. Why is it important? It comes in many tendon ruptures and all. For example, many of the drugs will cause the tendon rupture and all. While moving forward in our other chapters, I'll be explaining to you with regards to this. But for now, remember that Achilles tendon is a important structure. Okay. Then other muscle that is important is peroneus, which is in the lateral compartment of the leg. Okay, that's it. That is all and everything you need to know with respect to muscles of the lower limb. Then the main part is not the muscles that are important. The main thing that is important in the lower limb is about the spaces. Okay, so the spaces I want you guys to remember is the femoral triangle and the popliteal fossa. There is also a canal which is also a space which is important, called Hunter's canal or the adductor canal. I'll come back to that. So for now, you think there are three spaces, that is femoral triangle, the adductor canal and the popliteal fossa. Femoral triangle has its borders as sartorius in the lateral side, the adductor longus, the adductor muscles, right? Adductor muscles are on the medial side, right? The adductor longus is on the medial side, the sartorius is on the lateral side, and the inguinal ligament will be forming the base of the triangle. This is the triangle that will be formed. Okay, then with respect to what are the contents of the femoral triangle, all you have to remember is there is a nerve, that is femoral nerve, then there is an artery called femoral artery, and there is a vein called femoral vein, nav. Okay, so remember in that way, van from the medial side or nav from the lateral side. Okay, so whichever is easier for you, remember in that way, nav or van. There is a femoral sheath in the femoral triangle, okay, which covers the artery and the vein. Please do not confuse this with all the three. Okay, all the three are not the content. It is going to be artery and vein. The vessels, the vasculature is what is the content of the femoral sheath. Okay, that's it. Then just below the femoral triangle there is a canal. Okay, this is what is known as Hunter's canal or adductor canal. Okay, in between the adductor muscles this canal is there. So if I take a lateral section of the thigh, this is how it's gonna look like. Okay, so this is the femoral triangle. This is I'm looking from the side. Okay, from the this is the lateral view of the thigh. Okay, this is the knee, this is the leg. Okay, this is the foot. In this way I'm looking. Okay, that is the orientation I wanted you guys to give. I wanted you guys to learn about. So this is the femoral triangle, and just below, I told you, right, just below the femoral triangle there is a canal. Okay, this is the adductor canal, where the femoral nerve will pass through here and becomes the popliteal artery. Sorry, the femoral artery will become the popliteal artery through this canal. Okay, here just behind the knee, this space is called popliteal fossa. Okay, this space is called popliteal fossa. The artery, the femoral artery which came here became the popliteal artery, and down it goes and becomes the tibial artery and all these things. Okay, so this is where dorsalis pedis artery and all we palpate, right? We'll do the palpation just like the radial artery palpation. We'll do the dorsalis pedis artery palpation and all, right? So this is how we how the artery will get through. Okay, that's it. So these are the things I want you guys to remember with respect to adductor canal. So that is where the artery will become, the femoral artery will become popliteal artery. Then moving on, with respect to popliteal fossa, it is gonna be semitendinosus, biceps femoris and gastrocnemius muscle. See, I told you, right, there is something called as hamstring muscles, right? So hamstring muscles has three main muscles, that is semitendinosus, semimembranosus, then biceps femoris. Just like the biceps that we have in our arms, there is a biceps in the leg also. Okay, the same muscle. It's just same. Okay, so biceps in the arm, biceps in the legs are all are two similar things. Okay, so on the medial side, we'll be having biceps femoris tendons and and on the lateral side we'll be having membranosus and semitendinosus tendons. Whereas the gastrocnemius, I told you, right, the Achilles, this, consider this as Achilles tendon, this is the gastrocnemius muscle. Okay, so gastrocnemius muscle will also form the boundary of popliteal fossa. This is the fossa. Okay, what was the content? See, the artery which came from the femoral artery is here. Then we have vein and the nerve. What nerve? The sciatic nerve. Sciatic nerve, I told you, right? Sciatic nerve was coming from below. From the gluteus region, and it is moving down from the in the posterior thigh, and now it has reached the popliteal region. Okay, so here now all these contents are very important with respect to what the popliteal fossa has to provide. Okay, that's it. They won't ask anything much further with respect to popliteal fossa. This is the anatomy or the orientation. It is all about orientation that I am giving to you guys, because all you would have studied all these things in your first year and you would have eventually forgotten all these things, right? So that is why I thought I'll give you a orientation of lower limb, upper limb. All these things we would have studied in first year and we would have forgotten it, right? So that is why I wanted you guys to learn about some of the orientations and what are the things that are present in upper limb and lower limb. Okay, so that is the effort that I'm putting here. That's it. Okay, then we are done with bones, we are done with muscles, and we are done with spaces. Okay, so now we'll move on to nerves and vessels. So vessels are also done, right? So vessels we are done with, and now we'll move on to nerves. So nerves of the lower limb is divided as pelvis with division as pelvis and thigh, then the legs. Okay, so in pelvis, as I told you, we'll be having the major nerve, that is the sciatic nerve, will be starting. Okay, the sciatic nerve will start from there, but it doesn't have any supply in the pelvis. Okay, so the main nerves that supply the pelvis are superior gluteal nerve, the inferior gluteal nerve. Okay, so these are the two main nerves that you need to remember. Okay, because there is a pathology that I'm going to explain, so that pathology happens because of these two nerves. Okay, so superior gluteal nerve and inferior gluteal nerve. Okay, superior gluteal nerve supplies gluteus medius and gluteus minimus. Okay, medius and minimus, there are three gluteal muscles. Okay, maximus, that is where we are gonna give injections and all, right? So just like pectoralis major, this gluteus maximus is there. Okay, this is a major muscle. Now once I remove it, there are many other muscles of the pelvis, which I told you, right? For external rotation, internal rotation. Internal rotation was gluteus muscles, whereas external rotation was through piriformis, obturatus, gemini. All these muscles are also there, but important one is gluteus medius and gluteus minimus. Okay, so these two muscles, the gluteus medius and minimus, will be supplied by superior gluteal nerve, not the inferior. Please remember this. You'll definitely confuse in your exams whether it is superior or inferior. It is superior gluteal nerve which supplies the medius and minimus. Okay, that's it. Then coming to the pathology that I was telling you about, when the gluteus medius and minimus are affected, when the superior gluteal nerve is getting injured, we'll be having something known as Trendelenburg gait, where the drooping of the thigh will be on the opposite of the affected side. Remember it like dolly. Okay, dolly meaning drop on the opposite side and lift on the ipsilateral side. Okay, drop on the opposite side because the affected side is this one, whereas the drop is on the opposite side. For example, if the superior gluteal nerve is affected on the right side, the pelvis will drop to the left side. Okay, so drop is on the opposite side. Okay, so this is the Trendelenburg gait that we'll see when there is a superior gluteal nerve damage. Okay, so the test that we are going to do is Trendelenburg test. Okay, we'll tell them to walk, and this is how you would see the presentation of. Okay, then that is the main thing that you'll have to remember. Then coming to thigh, I told you, right, there is anterior compartment, medial compartment, and the posterior compartment. Anterior compartment, as I told you earlier itself, it is gonna be the femoral nerve which will be supplying, and the medial compartment, the adductor compartment, will be supplied by the obturator nerve. The posterior compartment is the sciatic nerve, the thickest nerve, right? We were discussing here in the gluteus, no supply is there. This is the posterior compartment of the thigh where the supply is there. Then coming down to the leg, it is gonna be, I told you, right, compartments: anterior compartment, lateral, and posterior compartment. Anterior compartment is being supplied by the anterior tibial nerve. Okay, so the anterior tibial nerve will be supplying the anterior compartment, whereas the lateral compartment will be supplied by the common fibular nerve or the common peroneal nerve. And then coming to posterior superficial compartment, I told you, right, in leg we are having posterior compartment, the anterior compartment, and the lateral. Here in the posterior compartment, one is superficial and the deep. Okay, please remember this. They might ask you a question about it. Which compartment of the leg won't be having any nerve supply or vasculature? It is gonna be the superficial compartment, which is not having any kind of vasculature or neurovasculature structures. Okay, the deep compartment will be having posterior tibial nerve. Okay, the clinical importance is the lateral compartment of the leg, that is the fibular nerve, right? Here the fibula was there. So if the fibula is getting if there is a fracture in the fibula in the neck, exactly at the neck, so this common peroneal nerve might get affected and there is foot drop. Okay, we'll discuss more about this in orthopedics, but for now just remember the clinical significance of this nerve and the compartments. That's it, guys. So that's it for your lower limb. Thank you.